Ayun po. And ayun po. So, without further ado, pag-proceed na po ako dun sa lecture ko po. So, today I have been tasked to introduce to you what is toxicology nursing, especially in the context in the Philippines, okay? So, so this will be a very short, and also maybe some technical terms will be provided to you, but I will assure you that I hope and sincerely hope that you will appreciate po yung aking presentation for today. So let me share first my presentation. Ayan. So I think everyone can see naman po my slides. Am I correct po?
Nakikita po ba, sir, ma'am, yung presentation ni sir? Thumbs up lang po kung nakikita po ninyong lahat. Thank you.
Okay, so mukhang makikita naman po ng everyone. So okay, I entitled my presentation today as Toxicology Nursing, a new frontier for Filipino nurses. Okay, so I will be presenting this as on behalf of the Toxicology Nurses Association of the Philippines, or TNAP, and we are established in year 2019, and we are a growing body of professional nurses that is specializing in clinical toxicology. So, moving on. So, the outline of our key discussion points in today's presentation is: one, definition of what is toxicology nursing, its scope of practice, specialty nursing practice in clinical toxicology, what it's meant to be a specialized nurse in this field, what are the core competencies involved, and emerging trends and issues. Also, what are the trainings and education required and that would necessitate that you are able to be called a clinical toxicologist, and a collaborative approach as well in the provision of care of poison patients. Okay, we define toxicology nursing as nursing specialization focused on the caring of persons inflicted with poisons, toxins, toxicants, and xenobiotics. All of these terms are actually encompassed in a single term, like xenobiotics, kasi lahat po sila can create havoc or a certain chemical or substances that would create certain effect to the individual that would make them ill. But also, a clinical toxicology nurse also provides care to those families that is involved in the caring for such persons afflicted with this, and communities involved as well, and also those people who are at risk in developing such toxicity in their exposure to certain substance. Okay. A toxicology nursing is actually a sub-discipline of a clinical toxicology. When we see clinical toxicology, it is involved those disciplines under the medical and clinical, which is, ibig sabihin po, meron pong patient na involved dun sa toxicological dun sa toxicological context. Also, it is a type of applied toxicology. Pag sinabi mo ng applied, we are using the body of knowledge of toxicology in a certain in a way, kumbaga paano po natin ginagamit yung karunungan or yung karunungan natutuhan dun sa toxicology, dun sa practice, which is in this form to the profession of nursing. And also, it is an emerging field of nursing. It is what I call a new frontier of modern nursing, especially here in the Philippines, kasi growing body pa lang naman tayo for here. And also, we can consider this as a knowledge-based specialization, or a toxicology nurse is a knowledge-based specialist. We may see that, for example, there are aspects like, di ba meron tayong mga maternal and child nurses, gerontological nurses, geriatric nurses. Those are all population-based specialists. Ibig sabihin, meron silang certain population that they cater. Also, however, ang toxicology nursing is primarily for knowledge-based. Ibig sabihin, we are the expert in such field, in such provision, or in a certain creation and using the nursing process as a part of delivering care in a specific population that is inflicted, in this context, inflicted with exposure to certain toxicants or substances. Okay, according to Abibi Kaso and Shigurasho, certain nurses, actually, a lot of nurses are unable to provide optimal care in this type of, or this specific type of clientele of patients. However, Petty and Doe sees there's a great relevance and importance on the role of nurses for such caring for this type of clientele. It is I believe that it can tip the balance in favor of survival and recovery against disability and death regarding poisoning incidents. Okay, the nursing process and the care of poison patients. Essentially, the nursing process can be used in any health issues, which includes poisoning. It is actually the basis of the scope of practice of nursing here in the Philippines, as stated in Republic Act 9173, or this outlines, ibig sabihin, kung gumagamit ka ng nursing process, therefore, you may be called as a nurse. Okay? So yun yung kumbagang scope of practice natin. If you are doing nursing process, now it's a part of your standard or it's a part of your scope of practice that in order to provide caring for this patient, you must utilize nursing process. That's why it's the core of toxicology nursing is nursing with the basis or understanding of toxicology. In this case, the nursing process utilized to address poisoning. Yun yung very specific na po siya. So there's a lot of cases and a lot of substances out there that could potentially harm, or when an exposure happens, there's a potential ill effect to these individuals, families, communities, and the society at large. Likewise, how nurses address any illness or health problems is pretty much like the same. Okay, there are numerous interventions that may be construed as not safe, or like may mga certain interventions po kasi ang clinical toxicology that may be somehow construed not safe in a certain context or in a medical treatment perspective. For example, pag meron kaming organophosphate toxicity, by the way, organophosphate is a lethal pesticide po. Ginagamit siya as pesticide. In order to counteract the effect, we are using atropine. Actually, dun sa ACLS protocol, dun sa Advanced Cardiac Life Support Protocol, that we use atropine actually as a treatment for bradycardia, for stable bradycardia. Actually, ginagamit po natin yung atropine na yan. And it's the max dose po niyan is 3 mg na ibinibigay every 5 minutes. However, pagdating po sa organophosphate toxicity kasi, mataas po ang binibigay namin dyan. Usually, nasa 3 mg yan every 15 minutes. Or minsan, nag-exceed pa kami to up, minsan nire-recommend ng book kapag mataas ang toxicity ng individual due to organophosphate toxicity, minsan mas mataas pa po yung binibigay namin, and we can reach to 5 mg actually. Then, meron pa pong maintenance yan. So, in conventional way, medyo tinotoxic namin, yung in order to counteract the toxicity, medyo nagbibigay pa kami ng toxicity as well, just to counteract the effects of that specific substance. Also, for example, kapag may alcohol withdrawal, ang ginagamit po kasi naming antidote or at least a management for that is high-dose diazepam. Ang diazepam po natin, just so you know, max dose po niyan is 20 mg per day. Pero meron po akong case na umabot po kami ng 100 mg. So that's 5 times more, which is allowed by the protocol. So in a sense, medyo outlier yung mga interventions that is used in clinical toxicology. Further, that is why there's a certain need to actually specialize on it kasi medyo mahirap po talaga siya. And as a result, many nurses from us actually has a certain reservations, hesitancy, and underconfidence in providing such care. Actually, marami po akong mga friends na natatakot magbigay ng mga gamot na ito. Yung sinasabi ko pong atropine kasi sabi nila, taas-taas naman ng dose na yan. Which is, in reality, it actually, even though na mataas yung dosage na binibigay na, it actually can help patients. That is specific for poisoning patients po pala. Okay. But these methods and techniques should not look upon as treatment of certain disease or illness. Yun po yung pinupoint po namin. Hindi siya treatment for, let's say, a chronic disease like diabetes, hypertension, or heart failure. Rather, it's a treating the poison in lieu of the person. Ibig sabihin, ginagamot po namin yung tao dahil nalason po siya. So that's basically, and it's the interaction between the person, the agent, and the environment, or what we call the exposure triad. In caring for poison patients as a clinical toxicologist, we use 2 paradigms as we utilize in such care. The central is the nursing process. Kasi nga, again, we are nurses here. So we are professional nurses, registered nurses who are actually able to provide care in all types of clients within the scope of our practice. However, the clinical toxicology nurse are actually delving further into the general principles of management of poisoning. And I will illustrate further ano yung mga general principles na ginagamit po natin in such provision of care. Okay, the nursing process, again, just a review, it's basically the process we use. We assess the patient, we provide or we understand what is the problem for that, using that assessment, we plan. So we provide objectives, goals, ano ba yung mga goals of care natin for this. And we create or we provide an implementation such as within the use or within the scope of our practice ng mga nurses, certain nursing intervention that may be, for example, that is within our scope, like those available sa nursing intervention classification. And also sa evaluation natin, which can be tested or actually evaluated using the nursing outcome classification. Okay, sa general principles of management of poisoning naman po, we use 6 steps actually, 6 steps here. First is the emergency stabilization, which and often it is the most important kasi we need for the patient to survive the effects of exposure of for certain substance. Kasi kung ang mahirap po kasing gamutin yung patient na tawag dito po na hindi makaka-survive initially. Kasi hindi po magpo-proceed lahat po ng mga subsequent principles behind it. And the next is clinical evaluation. Clinical evaluation actually entails a lot of activities. Sa clinical evaluation, they perform medical examination, physical examination, using, pwede din gumamit po tayo ng mga tools actually for using that. Also, ginagamitan din po siya ng mga analytical toxicological modalities. Yung mga ginagamit po natin, halimbawa po yung we test drugs dun sa using their urine, that's actually a part of a clinical evaluation. Other diagnostic procedures like ECG is relevant, chest x-ray, mga x-ray, some x-ray, mga x-ray procedures is actually relevant as well. So within that scope, that's called clinical evaluation. Also, there's limiting absorption. Mga limiting absorption, actually, this principle entails that principle kasi nito, as much as possible, i-prevent na natin makapasok pa sa system ng tao yung poison na yon. So in order to do that, we limit actually. Now, how we limit it? Una is the decontamination or the external decontamination. Did you know that around 70 to 80% of all, of at most, na exposure dun sa pasyente can be done or matatanggal natin by performing decontamination. Tatanggalin natin yung damit at paliliguan sila. Okay, so basically dun pa lang nakakatulong na tayo sa aspect na yun. Other advanced limiting absorption techniques are actually includes single dose or high dose activated charcoal. Gumagamit po tayo ng activated charcoal for removal of, pero hindi po lahat pwede pong bigyan activated charcoal. Also, minsan pinabibilis po namin at hindi na po na-absorb. So medyo nagbibigay po kami ng other means na para ma-prevent po yung absorption. Minsan, diba may mga certain medications tayo or toxicants that are actually difficult. Kapag may certain pH sa gut natin, sa GI tract, is mas faster yung absorption. Ang key example niyan is ang key example niyan is iron. Diba kapag sa principle ng nursing, kung gusto mong ma-absorb ng mother, yung sa maternal and child, gusto mong ma-absorb better ng mother yung iron supplements niya, we recommend orange juice kasi it can facilitate acidic medium in the gut in order to have a faster or an enhanced absorption of such medication. Pero sa aspect of clinical toxicology and overdosing, sa mga nag-overdose po ng iron, actually, we reverse it. Okay? Actually, we reverse it. Nag-i-introduce kami ng basic medium para po ma-prevent natin yung further absorption. So that's only a few of the tricks of the trade that we provide. Okay, enhancing elimination naman po, we also utilize this activated charcoal here, pero mas prolong po yung gamit po namin dito and usually mas frequent. Yan. So, other enhanced elimination, usually pinadudumi po talaga namin yung patient or gumagamit po kami ng certain mga in order to hasten the removal of certain poison. Also, antidotal therapy is one of also our general principle, is one part of our general principle. Antidotal therapy, usually pag tinuturo kasi ito sa nursing school, we teach to students, ito ang antidotes natin for this, for that. However, there are only few antidotes available in the world. Iilan lang po sila. Wala pa po sa 20 ang alam ko po. Unfortunately, yung pagbibigay din po na yun is meron din pong kasi una hindi din po siya readily available po, especially sa mga low resource countries na katulad po ng Pilipinas. Na yung mga antidotes na to is usually mahirap pong ma-procure. It's either kasi mabilis yung nila or kasi sobrang bagal ng utilization nila, hindi siya napaprioritize ng mga medical centers natin at hospitals. So, even though na may mandate actually the WHO for this, yung mga antidotal stocking. So, usually, also yung antidotes kasi, sabi ko nga po kanina, medyo complicated kasi yung relationship natin with the antidotes. Why? Kasi gumagamit po tayo ng high dose po sa kanya. Na high doses kasi ang ginagamit mo natin sa kanya. Minsan nga, if in retrospect, actually, in giving antidotes, minsan kailangan mo panlasunin muna yung patient in order for them to recover from that certain exposure. Pero kung wala po talaga tayong magagawa, walang available na limiting absorption technique, enhanced elimination techniques, antidotal therapy, the last thing that we could do is actually supportive care. And it's one of the most crucial aspect of nursing, clinical toxicology nursing. Why? Kasi it can tip the balance. The more we provide certain supportive care to these patients, the more they can survive. Okay? Kasi kung mag-feel na tayo dun sa other techniques available, if we provide the most optimum supportive care, we provide oxygenation, nutritional support, oxygenation support, ventilation, yung mga aspect ng kasi ang katawan po kasi natin, we are built to actually remove it. We are built to remove these exposures actually. Pero at a certain point lang, at a certain dose. Pero if we support the body to actually remove it, kahit po hindi available to mga means na to na available dun sa in this management of poisoning, it can actually help. Lalo po talaga kung low resource yung area kung saan nagkaroon ng incidents of poisoning. And finally, disposition. Pag sinabi po natin disposition, it can be related to the discharge actually. Sa disposition kasi, we determine kanino kailangan i-refer. Kailangan ba sa psychiatry kasi medyo ang patient nag-present na major depressive disorder kasi nagkaroon siya ng suicidal ideation nagkaroon siya ng suicide activity. Nag-culminate yung niya so maybe kailangan siya i-refer doon, or maybe nagkaroon ng overdose relation to addiction, so maybe kailangan sila i-refer to addiction medicine. Yung withdrawal kailangan i-refer yan sa sa neurology. Why? Kasi it poses a lot of neurological issues as well. Okay. Aside dyan, yung mga aspect of actually safety in our homes are actually emphasized in this section as well. Yung mga tinatawag po namin toxicovigilance and toxicoeducation. So toxicovigilance actually, yung mga reporting system natin ng mga high alert medications are actually considered pharmacovigilance or toxicovigilance. Kasi yung incidents ng medication error are actually rising and it can harm our patients. Yun. So other aspect yung mga toxicoeducation, diba may mga mapapansin tayo sa mga bahay po natin. Naka-close po ba ng properly yung mga disinfectants natin? Yung kerosene po ba saan nakalagay? Nakalagay po ba siya sa bote ng tubig? Na minsan napapagkamalang tubig siya na yun pala naiinom ng either ng bata or ng matanda, o yung tamang paggamit ng medication sa bahay. So all those aspects are actually within the scope of actually part of the scope of nursing as well. So sabi ko nga na dito yung emphasis ng nursing doon sa last part. It can support everything else in a such principle as well. Okay, continuing on, we utilize the nursing process in clinical toxicology. So sabi ko nga po, a clinical toxicology nurse is first a nurse. So we utilize nursing process. Subsequently, we also utilize the general principles of management of poisoning in order to provide certain care. We use these both paradigms as to enhance the care of poison patients in the perspective of a nurse. And it should be synergistic united and preferably complementary. Dapat nag-agree po sila ng dalawa. And most often, nangyayari naman po talaga. At sobrang bihira po talaga merong contradiction po yung dalawang principles po na yan. Okay, I have formulated a basic assumption to such integration of the two principles. First, the nurse is competent in the use of the nursing process. So inaasahan naman po natin to, especially if you are a registered nurse in the Philippines. Kasi it's our basic competency as we graduate from the nursing school. Likewise, the nurse can also utilize the general principles of management of poisoning. And this is actually presented or assured in our trainings in clinical toxicology. The nurse can, another is the nurse can simultaneously use the two processes that can provide beneficial and effective results if done and administered properly and safely. So, kaya kailangan po talaga ng knowledge in antidotal therapies, in the management, or at least in the administration of certain limiting absorption techniques, enhancing elimination techniques. Yeah. The two processes may share similarities. Any contradictory between them should be favoring the benefit of the patient. It's always like that. So it's always the benefit of the patient kapag any contradiction, pero sobrang bihira po itong nangyayari. And two processes are complementary and both are essential in the care of poison patients for the assure safe and effective care. Sabi ko nga po kanina. And finally, the knowledge gained from the general principles of management of poison is applicable and part of the intervention of the nurse. Sabi nga natin dun sa nursing intervention classification, yung NIC, na doon yung mga scope of intervention na pwedeng gawin ng nurse. Pero within the scope of the specialty, the GPMP actually can help as additional or what can a nurse do in order to provide certain care to this type of clientele. But it should not limit within this paradigm. Again, kailangan po natin bumalik pa rin sa nursing. Okay, what are the roles of toxicology nurses? Toxicology nurses can be found in the hospitals, in the community health. Yan. Mga provider din po sila ng emergency responses, yung mga emergency response nurses po natin. Also, they are part of healthcare administration. Some of them are working as part of na nagpo-promulgate ng mga policies and implementation of health policies that is related to the limitation of exposures. Yan. Also, one of the central as well is member of the team that provide care. Ito yung tinatawag natin poison information. Toxicology nurses can become poison information specialists. Kasi meron silang certain background kasi sa totoo lang. Dun sa poisoning. So they can provide support to healthcare individuals and mga layperson on how they can manage and treat poisoning in their homes or in the healthcare facilities. So we also learn yung mga roles natin sa history. Did you know that in World War II, there are actually toxicology nurses nurses are trained in order to provide care even in the roughest of time na paggamit ng mga chemical weapons. So in here shows na yung mga nurses providing care. Actually, this is a run actually. Isa siyang para exercise nila na kapag nagkaroon ng mga chemical warfare attacks dun sa lugar, ito yung mga gagawin ng mga nurses. Ayan. Also, during the war times, ang mga nurses, they provide care. For example, this soldier is actually inflicted with chemical burns result. Actually, this is a picture taken from World War I. Gumamit po sila ng mga blistering agents in order to incapacitate mga soldiers po natin. Also, gumagamit din sila ng mga terroristic gases or yung mga gas na ginagamit sa weapon of mass destruction. So one of them are actually mga nurses din po nag-a-attend po sa kanila. Okay, a clinical toxicology nurse is a specialized nurse who have an enhanced capabilities and capacities in the provision of care for patients who have ingested poisonous substances. This includes toxins, toxicants, and synbiotics. Also, those who have overdosed, yung either accidental or deliberate overdosing, who have misused certain chemical products. Ibig sabihin, hindi naman siya purposely used for this ailment or this specific type, pero nagamit siya in the wrong way that would cause an ill effect to that person. And those who have exposed to environmental and biological toxins such as envenomation from snake bites, yung mga plant toxins po natin, like for mga plant toxins like the poison ivy, and also marine toxins that available halimbawa especially during the summer season, yung mga tumataas na incidences natin ng paralytic shellfish poisoning, yung PSP. Tumataas din ang cases po natin ng tawag dito na jellyfish sting. So all of these are very relevant even though na very minimal or konti lang po talaga yung mga nurses that specializes in this field. As a clinical toxicology nursing, as a clinical nursing specialty, okay, this specific field is not necessarily yung sabi ko nga po, napapractice na siya noon pa. Even in World War I, World War II, and subsequent wars, nurses are actually part in treating poisoning and poison patients. Due to the limitation of nurses entering to the field, medyo konti kasi siya, and somehow they don't see the relevance. Few of them actually only see the relevance. Creation of such organization and body of knowledge remains a challenge. So, for example, in the US, clinical toxicologists are usually pharmacists. Why? They have a background in the aspect of pharmacology. So, kasi ang pharmacology and toxicology are actually sister discipline po sila. Usually, hindi sila napapaghiwalay. Ang toxicology kasi po, unang-una, siya yung discipline of exposure to certain substance that would create an illness. However, sa pharmacology naman, it's the exposure to certain substance that can manage disease naman. So basically, they share similar mga principles, but in a different way and outcomes. Yung body of knowledge nila is nagrepresent. And while medical toxicologists are physicians, they are that are trained in the discipline. Marami na po talaga tayo medical toxicologists actually. Ayan. So, pero medyo mahirap po kasi it remains a challenge kasi matagal po. Kasi you need to specialize first in a certain discipline like emergency medicine, internal medicine, or you must undergo residency program first and become a diplomate. Then sa subsequent fellowship program pa lang po sila makakapasok. So medyo matagal po talaga, and usually it takes 12 years of training before a certain person can become a clinical toxicologist or medical toxicologist. And also, it's an other toxicological disciplines available like environmental toxicology. Usually, ito yung mga ginagawa ng mga sanitary engineers, yan. Analytical toxicology that's specific for chemists and medical technologists. And forensic toxicology comes from other disciplines as well. Okay, one presented, for example, in 1959, Tonyan and Jensen presented the role of nurses in poison centers, both in poison information and in health department. Actually, in health department, they become champions of care, especially in the areas na medyo, yun nga, na magkaroon ng mga poisoning incidences, etc. Sa poison information naman, as early as 1959, as documented in 1959, they become poison information specialists as well. Also, a description of a role of a nurse in toxicology is presented in the paper of Mrs. Kornbacher in 1976 as the aspect of occupational toxicology naman. Okay, examples from other countries. In the UK, there are some toxicology specialist nurses under the National Poisons Information Service, or the NPIS. Actually, this is the central poison information service na available sa kanila. In the US, nagkaroon ng establishment na certification of poison information specialists, and nurses can actually take this given a certain competencies are presented to them. Also, in Australia and New Zealand, there are some practicing specialist nurse in toxicology. And in Thailand, there's they also act as poison information specialists. Okay, clinical toxicology nursing in the Philippines. The UP NPMCC has been producing clinical toxicology trained nurses since 2003. Actually nga po, yung isa po sa mga produced in that year is actually my mentor here in Philippine General Hospital, si Ma'am Myra Oliver. I don't know if some of you are familiar with her kasi part siya ng Division of Nursing Education and Training here in the PGH Nursing Service. But due to the limitation of number of nurses completing the program, usually ang graduates lang po kasi niyan is around 10. Ang pinakamarami na pong na-produce namin is from last year, which is 22. Yeah, so medyo maba ano po talaga ang production po niya kasi matagal po yung training program na yan. And usually it's very intensive kasi it's a relatively new discipline for them eh. So mobilizing nurses to form an organization become a challenge as compared to other specialty nursing organizations. Primarily one of the challenge from it is actually yung magkakalayo po kami. Nasa different regions po kami ng Pilipinas. So some of my colleagues came from the Region 1 in Cagayan Valley. Some of them are in Ilocos, in Northern Mindanao. So very diverse, malayo po kami. Plus yung mga practicing areas po namin is very magkakalayo rin po sa isa't isa. So medyo ang hirap po talaga i-form ng organization at start. So there are numerous overlaps with other specialty nursing organizations. When we first presented this to the Professional Regulation Board of Nursing, tinanong nga nila sa amin, anong difference nyo sa occupational health nurses, sa Philippine nurse environmentalist? So sabi namin, primarily kasi po ang mga clinical toxicology nurses handles poisoning in the context ng meron na talagang na-expose. Pero for ONAP and PNP, usually sila on the preventive side. I'm not saying that clinical toxicology nurse cannot or will not be able to provide preventive. It's also an integrated part or essential part of being a toxicology nurse. Okay, what are the core competencies of a toxicology nurse? One is dapat talaga, sabi ko nga po, kailangan bumalik tayo sa nursing process. Dapat they can create nursing care plan for certain poisoning patients that is very complex due to their poisoning incidents. So gagamit po tayo ng mga competencies that resulted from emergency stabilization. That's why nga po important na may idea on how to emergency stabilize ang mga ang isang nurse that is going to toxicology nursing. Clinical evaluation, dapat familiar sila sa maraming laboratory and diagnostic procedures. They can at least they have the ability to process certain biological samples, yung mga ganun po. And they can perform PEs. Sa PE po, dapat kaya nilang makapag-elicit ng mga toxidromes or ma-identify mga toxidromes. By the way, toxidromes are syndromes of toxicity. Ibig sabihin, may mga certain toxicity that presents a certain pattern. Almost always available dun kapag nagkaroon ng exposure. Especially kung unknown po yung exposure, we use toxidromes as to reverse engineer yung tawag dito, yung exposure, especially kung wala po kaming idea or very unknown yung substance po na yun. Limiting absorption techniques. So yung mga processes na ginagamit for this, yung tatlong po natin, yung limiting absorption, enhancing elimination, and antidotal therapies. And also, a nurse should be competent in providing supportive care. And finally, be able to refer to certain specialists in other key areas in order to have a holistic care for such patients. Okay, sa emerging trends and issues, okay, ang dami na po natin in the era of innovation, in the era of a lot of things that is happening. There are cases that nag-a-arise yung mga novel psychoactive substances na bago pa lang siya. Kasi yung mga tinatawag natin mga designer drugs, ayan, it's actually a threat yan sa atin. So clinical toxicology nurses must actually inform themselves or be knowledgeable to such things. Yung mga chemical and yung mga use of chemicals in terrorism and and aspect of security, yung paggamit ng excessive agrochemicals and pesticides in treating yung mga food natin. So actually, it's a malaking no-no yan. Yung increasing and trend misuse of disinfectants and other chemical sterilants. Yan. So actually, yan yung mga isa sa pinakamalaking mga challenge namin as well. Then nandiyan din yung encroachment ng human population sa mga dito sa environment natin that would enhances yung frequent exposure natin sa mga wild. Kaya nagkakaroon tayo o dumadalas tuloy yung yung mga snake bites, yung mga envenomation. Also yung mga illicit substances natin that ever present. Yung mga marine na yung sometimes kinakain nating mga marine mga marine products are actually sometimes harmful kapag improper or wala tayong certain guidance or knowledge behind it. Also, the use of mga vices natin like alcohol, cigarette, these are actually emerging trends and issues in the scope of clinical toxicology nursing. Okay, one key example in the year 2019, at least 8 dead after drinking Lambanog in Laguna and Quezon. Actually, I'm one of the duty po ako that day, that night. So hindi po ako duty that day as a toxicology nurse actually. Duty po ako doon na as an emergency nurse. So nung biglang nag-declare po ang ano po ng outbreak for methanol outbreak po that time, so it's a challenge for me kasi baguhan pa lang po ako nito, kagagraduate ko pa lang po dun sa training program. So sabi ko, oh my God, challenge na siya agad sa akin as a toxicology nurse. And I become one of the part of the team that helps in the caring for such large population of outbreak. So ito sa mga emerging trends na yung mga backyard na yung mga backyard or moonlight or moonshining natin na mga alcohol, yan. So malaking challenge din po yan sa atin. Kasi we cannot assure you safety kasi ng mga consuming public for that. Also, in ammonia leak in Navotas that had killed one person. Actually, that's a child. And 60 are actually been hospitalized. This is just recently in 2021. Actually, na-repeat ito in the year 2022. Na sabi nga namin, ano ba to, daily annual challenge na po ba to sa mga toxicology nurses? And is also in the field of toxicology as well. Yan, so yan, yung mga bagay na nagiging challenge na rin po sa amin. Formalizing the specialty nursing. Establishment of the specialty nursing organization that focus on clinical toxicology happens in year 2019. Nag-draft kami na yung mga, sabi ko po na, ang isa challenge po kasi in order to create such body is to identify those body and invite them to be present in a certain location. Kasi kailangan namin mag-agree. Yan. So kailangan namin agree so nag-presentation kami that day, nagkaroon kami ng brainstorming. So we drafted our first constitution and bylaws for the development and creation of an organization focused on clinical toxicology. So that's why na-promulgate or na-produce namin yung group of individuals, actually 23 kami noon, na-produce namin yung yung document na yan that would bind us as a body, a professional body of nurses that specializes in this discipline. After that, we proposed it to the Board of Nursing, kaya nagkaroon kami ng consultations with them. This is on behalf of Board of Nursing Arcos that night, of Gloria Arcos. Then formulation of standards of care and other pertinent documentation. So we drafted the standards of care using the PPNPS. The PPNPS is the Philippine Professional Nursing Practice Standards. So dinarap po namin using that in order for us to create standards of care na available, or ito yung magiging basis ng practice din ng clinical toxicology nurse. Again, this is in line with the consultations with the Board of Nursing as well. Mga projects pa po namin is recruitment and membership, and other future directions is actually the finalization of our accreditation and certification program for nurses that would want to enter the field of clinical toxicology. Okay, just to show the picture, ito po yan. So during the pandemic, even in year 2020, busy po kami na meron kasi consultative meeting with Dr. Gloria Arcos, representing the Board of Nursing at the time. So isa po itong battle of the brains na po talaga, as a sharing lang, na talagang nitty-gritty, inisa-isa niya po yung mga documents po namin, and she helped us to identify ourselves. Sino ba kami as a professional or as a specialized discipline in the field of nursing. Okay, so here's the basic framework for it. So the Professional Regulation Commission under the Board of Nursing can create specialty boards, and that specialty boards oversees the specialty nursing organization. This is in lieu to the mandates of the Republic Act 9173, or known as the Philippine Nursing Act of 2002, and the Republic Act 10912, which is the Continuing Professional Development Act of 2016. So under this, so yung mga continuing professional and advancement programs na available sa Board of sa Professional Regulation Commission is actually yun yung mga basis on how we created it. In the last Congress, actually, ito yung mga bills that approved na or has specified certain or provided certain aspect of formulation of specialized nursing practice in the Philippines. The House Bill 9389, the Senate Bill 2446, and the Senate Bill 2409. Ayun yung mga bills that actually na nag-ano ng mga advanced practice nursing, specialized clinical specialty nursing yon. So, yan yung mga nag-outline ng mga proposed changes in the nursing law natin po. As of now. Kasi June na rin po siya kasi it's almost 21 years na rin na kailangan natin siya. So marami na rin nagbago or nagkaroon na rin ng expansion the scope of practice ng nurse. Also, we aligned our scope of we aligned our program both for certification and the training and development of clinical toxicology nurses, the Philippine Qualifications Framework. The Philippines Qualification Framework is actually promulgated in order to assimilate us or nagkaroon tayo ng integration with the ASEAN kasi kailangan magpantay-pantay tayo within the ASEAN nation. So a nurse in the Philippines can perform and have the similar competencies available in nurses in Thailand, Cambodia, or elsewhere in Southeast Asia. So yun, so within this premise, so as much as possible, sinusunod po namin itong Philippines Qualification Framework in order to establish yung aspect po ng specialization po namin. By the way, a clinical specialist is actually at level 6, mga baccalaureate degrees po yan. Yung mga BS nurses po natin or yung mga recently or mga graduates of the Bachelor of Science in Nursing. Okay, so basically ito yung accreditation process po namin. At level 6, sabi ko nga po, sila yung mga clinical nursing specialist or specialty practice nursing or specialist in that specific field. So level 6 siya, under siya ng Bachelor of Science in Nursing. Pero dapat meron po siya 3 years of nursing experience and a specialty training po. Pero ang specialty training can be determined by the body, kung sino yung nag-govern sa kanila or the body of experts available. So kung sa mga clinical toxicology nurses, yung TNAP po yung nag-determine na ito yung kailangan mong mga training na kailangan. Kasi ito yung ipopropose po kasi namin sa Board of Nursing. For level 7, advanced practice nursing naman po ito. Actually, advanced practice nursing sa Philippines is not yet as well known in compared to our counterparts in the Western world and some aspects in Asia. Ayan. Pero we, in preempting or in preparation, kung magkaroon man ito sa amin, nag-develop na rin po kami ng mga certain requirements. Often, this is at the master's level. So yung mga graduate po ng Master of Arts in Nursing, Master of Science in Nursing, and other master's degree program can actually delve into the advanced practice nursing in specific for clinical toxicology. And finally, for the level 8, the advanced practice nurses. This is at the doctorate level, doctoral level na po ito. So they're primarily in the focuses on research and leadership and governance roles. So these are just one of the few frameworks we used. Okay. Poison is everywhere. Yun lang po yung tandaan natin. Poison is everywhere actually po. The air you breathe, yung mga oxygen, kapag na sobrahan po yan, can create oxygen toxicity which is presenting with blindness. Yun yung usually dahilan yan. Kapag nasosobrahan tayo ng oxygen, yung mechanism for us to breathe are actually eliminated. Kaya that's why it's very cautious tayo sa pagbibigay ng oxygenation. The water you drink, the very water you drink, aside yung mga potential toxins na present doon, the water itself, kapag na-dilute masyado ang blood, dahil inom tayo ng ng tubig, can cause harm. Kaya po meron tayong water toxicity. Then the food you eat, are you sure na safe siya sa pesticides, hindi ba siya sobra sa pesticides or overuse of chemical products in formulation or mga gumamit po ng certain products in preservation. Yung mga halimbawa po yung mga processed food natin like tocino, tapa, yung mga actually presented dyan sodium nitrite. So which is actually toxin, it's a toxin on its own. The very body you have is producing toxins. Yung mismong katawan po natin po-produce din tayo ng toxin. But you cannot do anything about it kasi it's a part of the process of our world. It's a part of our environment. The only means that you can Kaya po wala tayong tinatawag na total elimination of risks. Kasi ang risk po natin is all about how much you have been exposed to certain degree or to certain amount. So yun yung mga dogma or at least yung mga doctrine na available po sa clinical toxicology. According to Paracelsus, all dangers in gift, und nicht ist of gift. Alin din dosis macht, das ein Ding kein gift is. Ibig sabihin po yan, it's a German term actually po, na Paracelsus, or known as the father of toxicology. All things are poisonous. Lahat po ng bagay, poisonous. We can consider them as poison. And nothing is without a poison. And only those makes a thing poisonous. Kung nasosobrahan ka, that makes become poisonous. Yung mga gamot po natin can help us alleviate our illness, can control our symptoms. Pero pag nasobrahan yan, nag-overdose ka, it becomes poison. So toxicology has a lot of discipline within it, and nursing is also part of it. What separates toxicology nursing from its predecessors and counterparts? Actually, the answer is we focus on the persons afflicted with poisons and not just on the poison alone. So, kung available toxicants, some toxicologists are preferred studying it. Some of them prefer studying the environment on which they are available. Pero sa toxicology nursing, we are focused on the persons afflicted with it. What separates us from other disciplines. Okay? As a part of it, dapat ang clinical toxicology nurse meron siyang knowledge sa chemistry, in organic chemistry and biochemistry. Meron siyang deep knowledge in pharmacology, in biology, in certain aspects of medicine, including diagnostics and therapeutics, and sometimes for forensic science. For poisoning presents you with something new every day, and that's actually one of what makes clinical toxicology nursing as what you call it exciting, because it presents you something every day. Every case is a challenge and it's unique and it's on its own, and every case is an opportunity to learn. Kasi ayan, every case na nagrepresent sa atin, even though they share similarities to other cases, it will always be unique, and you have something to learn from it. And I believe there's no two poisoning cases that are the same. Basically, in my humble opinion, you are suited as a toxicology nurse if you are fascinated with new things, facing new challenges, and ready to learn and adapt in the shortest time possible. Okay, what are available toxicology training for nurses? Sa Asia, Hong Kong, I found Hong Kong has one. Philippines, sure ako po dyan. So CHONA, so Australia and New Zealand available din po. So North America, USA has it. Sa Europe, medyo mas marami po sila, which is available sa Poland, sa the Netherlands, UK, and Sweden. And ano pa po yung mga ginagawa ng toxicology nurses? We perform pharmacovigilance, safe medication administration. Ito yung mga advocacies po namin. Proper hospital waste management, safe disposal of chemical spills, and safe decontamination practices. Okay, anong requisite po in order to become a clinical toxicology nurse? As a prerequisite, at least a 3 years nursing experience. Kasi first and foremost, kailangan mo na ma-develop kasi yung nursing competencies after they graduate. So we expect at least a 3 years, medyo strong na yung foundation niya in nursing. And we prefer to be na meron siyang background sa emergency and acute care or intensive and critical care. Though other disciplines is also encouraged. Why? Kasi masyadong maraming facets ang toxicology, clinical toxicology. Why? We need people who are experts in mental health and psychiatry, those experts in medical and surgical cases, kasi may mga poisoning that would help us better understand using their principles, using their knowledge behind it. Also yung mga population-based experts like in the pedia, kasi madalas nalalasan ng mga pediatrics, even the OBGYN or mga obstetrics nurses natin, yung mga prevention ng mga toxic exposures during pregnancies actually can be helpful in the practice as well. Also, as a requisite, we need a BS in nursing degree and also dapat registered nurse po siya. As educational or training requisite, dapat nag-undergo siya ng training sa clinical toxicology. Okay. Merong crash course yan, usually 3 days yan. And it's very intensive, so medyo taxing yan pag kinoconduct po namin. And mostly focus siya sa acute care. Pero kung medyo mag-dwell po tayo sa medyo mas chronic and medyo complex cases, usually kailangan mag-undergo po siya ng 3-month program. So basically, isa siyang semester. And meron tong rotation and clinical immersion dun sa sa Poison Center. Kasi kailangan ma-familiarize nila totally yung mga how a certain clinical toxicology or the toxicology nurses performs their duties and responsibilities. Okay, sabi nga natin, earn your BS nursing degree, pass the NLE, at least 3 po tayo. 3 years of clinical experience, take the toxicology training course, pass the accreditation exam, and get certified in the field. By the way, we have a certification program in the with the TNAP, or Toxicology Nurses Association of the Philippines. TNAP recently promulgated the standards of care for toxicology nursing in the Philippines. We passed it this year, kasi we felt na talagang there's also already the need. Pero yung drafting po nun is actually 3 years kasi we need to polish and repolish po yung standards of care po na yun. Kasi it will be the basis of our specialty nursing practice. Okay, I'm a toxicology nurse. Yun yung tanong ko, what's your superpower? So, eto mga superpower po ng ating mga toxicology nurses. They can decontaminate yung mga persons or people afflicted with chemical weapons of mass destructions. They go into the post information specialist discipline. They provide health education, toxico-education to schools, families, and communities. They help people afflicted and families, communities afflicted with poisoning. And we help in the universal health. Sabi nga natin, kung may isang maiiwan doon sa or maneneglect pa yung certain aspect of the healthcare system, and most often poisoning is one of them, we cannot attain yung pinapangarap nating universal healthcare. That ends my presentation and maraming salamat.
Attendance ka naman.
Thank you, ma'am. Thank you, sir. Again po, sir, in behalf of PSMU po, and I think mamaya may message po si Ma'am CHONA, our chief nurse. We would like to appreciate the presentation of our resource speaker, Mr. Son. Sir, thank you very much again. To our chief nurse, ma'am. Ma'am, can we present?
Yes po. Yes, Ace. Can you flash po the certificate?
Thanks. One moment lang, ma'am. One moment. Un momento.
So, Sir Son, on the... sige. Sir Son, on behalf of our Director, Health Service, Police Brigadier General Jezebel D. Medina, we would like to express our heartfelt gratitude. Thank you very much for your time, effort, for sharing this with us, this wonderful, ito pong during the celebration po of the International Nurses Day. New learning po ito para sa mga nurses, because isa po sa I think this is also one of the specialty area where we could avail this kind of training po. So my question lang po ako while waiting for the awarding of certificate, could it be possible po na this could be, kasi sa ER po, when you specialize in the ER, imported na po or tinatakal na po itong toxicology nursing. So, pwede po ba ito maging subspecialty na lang? And how many years po ito or months nag-undergo ng training po? Thank you, Sir Son.
Ayan po. Actually, we cannot fully say po na maging subspecialty po siya kasi wala pong nag-govern na single entity sa kanya. Kumbaga po, hindi po fully pwedeng kunin ni emergency nursing, Hindi siya pwedeng fully kunin ng occupational health nursing kasi may mga disciplines din kasi siyang gano'n na hindi pwede. That's why on its own, pwede siya mag-stand alone. Kaya nga po siya, sabi namin, sige, kaya po tinanong kami, is it, dun sa scope pa lang po, tinanong kami na ano ba yung difference namin? Or hanggang sino ba yung population catered? Or ano ba yung knowledge base namin? Kasi in pure honesty po, wala po talaga kasi pwedeng mag ano sa kanya kasi it's
Separate
lahat po
entity
ng
po.
nurses can act. Yes po, yes, all of nurses actually can become toxicology nurses. Even in the, sabi po nga namin, it's an opportunity for even for uniform personnel kasi ano sila exposed sila sa mga ganitong bagay po. Kasi sila yung mga nasa groundwork, na doon sila sa field po eh. So as far as I know, alam ko po and marami po talaga rin ako pakilala. Even my mga batchmates ko po kasi pumasok din sa kapulisan, pumasok sa Bureau of Fire Protection, naging mga pumasok sa army sila, yung iba pumasok talaga. So in our sharing experience, sabi nila, kasi medyo saan nga naman sila lulugar. So sabi ko, we offer clinical toxicology nursing as a specialty for this type kasi you can focus on it, become the expert on your area, become that base expert for your area. Sabi nga namin, we are the knowledge-based experts for this. So, yun po yung actually, opo.
Thank you for enlightening us po. So for those nurses who are interested to avail this kind of training, I think Sir Son, isa na si Sir Son doon sa mag-guide sa atin sa inyo para doon sa training. Kasi yung napag-alaman ko, you are also naging ER nurse ka din po, Sir Son, ano? Naikot mo yung buong
Yes po.
area.
Actually, yeah, naikot ko na po si PGHU talaga.
Face mo, Sir Son, na-remember ko, pinakilala kayo sa amin. So, nandoon ka po during the during the graduation of our PNP Nurses. So,
Ma'am, sir, ano ko lang po sir bago natin i-present sa kanila sir. Ma'am, i-open ko lang ng konting siguro hingi lang din tayo ng mga questions sa mga attendees ngayon. Baka naman meron din sila. So, the discussion is now open for any questions that you may have. Anyone? We'll give you a brief moment po para i-raise po yung mga inquiries ninyo. Baka marami po mga interesado dyan na magtanong. Anyone? You can raise your hand or you can also put it in the chat box kung sakaling meron kayong mga questions. By the way, I already forwarded yung Facebook page, website ng Toxicology Nurses of the Philippines doon sa chat box. I also forwarded the online information of the National Poison Center of the Philippines as well as yung pong kanilang Facebook page. So if you are really interested to learn more about these things, and ma'am, i-share ko lang po muna ma'am yung something about I learned something doon sa nung naghingi po tayo ng information sa registration, ma'am, may natutunan po akong bago. So let me just share.
Go ahead po.
So ma'am, sir, i-share ko lang po yung sa Google natin. So right now, as it stands sa mga nag-register po, karamihan po ay lieutenant. But what I was really interested was more on ito ma'am. Do you have experience or training related to toxicology or poison management? And majority po ng nag-register ay wala. They don't have training. So magandang feedback po ito lalo na sa mga PNP nurses that it's really one of those areas na wala po tayong training in terms of implementing it here. So maganda rin pong feedback ma'am na nakuha natin dito is ito po. Prior po to seminar, ano po ang kaalaman nila tungkol sa National Poison and National Poison Management and Control Center? and its contact number. Nagulat po ako, pero hindi naman nakakagulat. Karamihan po kasi hindi talaga alam. Pero dito sa PNP po, based doon sa mga nag-register, 92%, napakataas po, ay hindi po natin alam. So just imagine po, ma'am, sir, that this institution, yung National Poison Center, is already existing even before. Matagal na po siya nag-exist. Pero nagkakaproblema po tayo kasi if ever na meron po tayong na-encounter na poisoning kahit sa trabaho o sa bahay natin, unaware po tayo na meron pala silang contact number. For the information of everybody, when I did my OJT with Poison Center, ayan si Sir ang aking professor doon, yan po yung trabaho namin. So part of the OJT is kami po yung nakatasking na parang call center doon. Kami po yung nagko-coordinate, kami po yung nagre-receive ng calls. So yan po yung makakasagot po sa inyo. So if ever na, by the way, this is all over the Philippines po. So kahit nasang region po kayo, pwede kayong tumawag sa National Poison Center if you have cases or probably ikaw mismo na poison ka o yung family mo, wag naman sana. You can call this center para mai-coordinate po yung problema niyo. Another thing is 87% po na nag-register do not even know yung pong ating Toxicology Nurses Association of the Philippines, which is Ma'am and Sir Son, ito po yung isang kailangan natin i-address, no? Kasi it seems like kahit na meron ng specialization, recognized na po ito ng PRC at saka ng Board of Nursing, it seems like there is still undervalued yung specialization na ito. Lastly po, Sir, Ma'am, I would like to present to you what I presented before doon sa agency implementation when I graduated. This program under the National Poison Center, yan po yung graduation namin. Si Ma'am Arban po yung aking chief nurse, chief RMDO at that time, and I was the chief nurse. So skip ko na lang po ito. Ito po yung isa nating situation, no? I hope these are lessons learned from our past. This was one of the things na nangyari before. Again, hindi ko po alam kung ano yung mga nangyari dito. I tried to ask about it, but at that time, it was under investigation. Pero ito po yung nasa balita. So ito po yung nakarating dun sa balita. And hopefully po, hindi maulit. And then, did you know na noong pong way back pa po ng PC Times, na 19 out of the 225 recruits na naka-ingest po ng water laced with poison na poison po ito. Nabalita po ito noong araw pero hindi na natin matandaan. Just in case lang po na baka po kayo ay nagtataka, hindi naman applicable yan sa PNP or sa ating nurses dito sa PNP. Meron na po tayong history and probably hindi lang na-highlight, baka po along the way, marami rin po tayong mga experiences. When I was PO1 po, ilang beses po akong nagka-diarrhea dahil dyan sa training na yan. So, I'm pretty sure one of you during your training days nakakain ng tulingan at kayo po ay nagtae dahil doon. So another po is during police raid po, yung mga drug laboratories, these are laced with a lot of poisons. Just imagine po kung yung mga police po natin, mga kasama natin would now raid this mga drug laboratories po na saan nandun po yung mga toxic materials. Ang question po natin dyan, pag nag-raid at mayroong isang bottle doon o highly hazardous or poisonous bottle, biglang nagkaroon ng poisoning po doon, ang question is, saan dadalhin ngayon yung ating police? So yan, another po yan. And then one of the things that I was very interested at the time was the exposure of the lead during firing. So lahat naman po tayo nagpa-firing, pero did you know na nakakabobo po yan, yung lead na yan. So mga kasama po natin kapulisan na inaamoy pa yung pulbura, ingat po tayo. Then next po is just imagine po yung ating mga detainees na nandyan po sa mga police station, and I'm pretty sure yung mga kasamahan po nating mga nurses, lalo na sa SHUs. What are we doing in order for us to be able to negate or probably prevent or probably whenever there are things that are already happening. Kung kunyari yung nahuli natin doon is drug addict, wag naman sana, bigla po siyang, doon po siya tinamaan ng withdrawal syndromes. Ang question is, what do we do now as a health responder? And of course, ito po, very famous, no, yung former president po, and since galing po ako sa PSG, this is one of my, lagi kong pinag-aaralan yung paano po pag yung presidente natin ay pinoison. So this is one of the cases that I had before. The president of Ukraine was poisoned with digoxin. Ayan po yung nangyari sa kanya while having dinner. And then of course, ito, hindi ko na po lalayo. Sa tayo po, sa mga police station, mahilig tayong kumain. Sa mga kung saan-saan, kasama ng ating mga pamilya or probably tayo-tayo lang. Mahilig tayo sa mga turo-turo. Question is, paano pag tayo po ay na-poison doon? So as shown in the picture, ito po sa NYPD po ito, yung pong Shake Shack na kung saan kumain po yung police at nagkaroon ng food poisoning. So right now po, as I've mentioned, the problem is less po yung training natin, wala tayong exposure, and then yung awareness natin of what is toxicology nursing and what is clinical toxicology nursing and how does this apply to us. More so is yung control systems natin. So what was my objective before after graduating this course was to be able to implement a poison management control development program. Sa NCRPO po ito before. So maikli lang po yung aking stint as chief nurse. So ito po yung present ko noon. Sana na I hope this will be a template for all chief nurses po ng different regions. If you are interested to know this proposal, I can share it with you. Mapapansin nyo po, I started with how to organize and then policy development and then creating po the core team and then magkakaroon po tayo ng OJT period with in collaboration with PGH, National Poison Center, and the Toxicology Nurses Association of the Philippines. And then we are now going to create Poison Coordinating Center. Hopefully po per region po sana. So nung time ko po as chief nurse doon sa NCRPO, this was my proposal. And hopefully matuloy po ng iba. And then of course, we are going to train our healthcare worker and then magkakaroon po tayo ng poisons awareness seminar to all police officers, not only health service. So yun po ang aking naging proposal po before. So with that po, ma'am, sir, sorry po, nisingit ko lang po talaga para lang po sa kaalaman ng marami. And then now I am sharing with you the certificate of appreciation for our panawing pangdangal po. Teka lang po ha. Ayan. So ma'am, ma'am WAMILDA, ma'am.
Opo, Ace. So certificate po of appreciation is hereby presented to Mr. Son Michel M. Mariano for having participated, for having imparted his knowledge and expertise as resource speaker during the conduct of seminar on toxicology nursing for PNP nurses. Given this 12th day of May 2023 at PNP Health Service, Camp Brigadier General Rafael P. Crame, Quezon City. And I sign. Okay. Thank you very much po, sir. And congratulations po sa ating lahat.
Thank you very much po and happy na International Nurses Day for everyone. Yan po. So hopefully magkaroon po tayo ng strong partnership as we embark to certain dito sa mga ano po natin ito. Actually pangarap po namin talaga mag-outreach po sa lahat po ng mga nurses, even yung mga your nurses in the uniform service. So maraming salamat po sa pag-invite po sa akin dito and hopefully to see you next time. I don't think so that this will be the end of it. Maraming salamat po ulit.
Sir Son, huling pahabol lang po. Sir Son, would this now be a jumping board po for TNAP to be able to have a close collaboration po on the nursing division of the PNP wherein ito simula lang po ito, patikim pa lang siya. Maybe we can plan out a long-term plan wherein TNAP will now work with nursing division in creating po that atmosphere of continuous learning. Pwede po ba yun?
Of course, TNAP will always be ready po. So I will be always be accommodating po lahat po ng nurses po natin. And so we have a lot of mga subject matter experts din po natin na makakatulong po na ma-develop yung continuing program, professional development po ng nurses sa kapulisan po natin.
And lastly po, sir, malaki po ang pasalamat ko sa ating president po ng TNAP for accepting my application to become part of the TNAP. And then nadagdagan na po yung aking pangalan sa huli, yung CCPN, certified po na. So thank you, sir. Sa mga kasamahan po natin, sir, paano po ba sila maging katulad po ninyo na pagka gusto po nilang mag-start ng journey, lalo po yung mga ating nurses sa mga PNP? Paano po ba siya?
So, ayan. So actually, kaya as recent yung promulgation sa kanya, yung agreement na rin po ng Board of Directors namin that time is that tinanggal muna namin yung exam kasi we believe na yung 3 months will suffice. However, dun sa mga hindi makakapag 3 months, kasi we have a lot of ito din yung tinuro sa akin ni Bon Arcos that time na hindi lahat pwedeng mag-undergo ng 3 months. So yun sabi niya, pero how much training time would you require para magkaroon sila ng certain proficiency dun sa practice, dun sa specialty practice mo? So actually, we recommended 100 hours. So not necessarily isang biglaan po yun. So dapat sa loob ng 3 years, makapag-accumulate sila ng at least 100 hours of training na focused sa clinical toxicology or doon sa aspect ng toxicology. And also, finally, kailangan nila makapasa po dun sa exam. May exam po kasi for dun sa mga hindi po makakapasok dun sa 3-month course. Yun. Pero in the future po and sa future direction naman po talaga ng advocacy din po namin na talaga kailangan mag-embark almost all kasi hindi po talaga kasi tinuturo sa sa basic nursing education ang toxicology. Pero as we have seen it, dumadami po yung cases at marami pong nurses ang actually not prepared. Hindi lang po even as here in PGH na meron na kaming poison center na hindi talaga sila fully prepared in actually provision of care for this type of client. So in our vision, we hope that the Filipino nurses are actually poison care ready.
Thank you, sir. So, Ma'am WAMILDA, ma'am. So, we have a commitment from the President of TNAP, si Sir Son. Marami. Sir WAMILDA, ma'am. I think baka po meron kayong message to all our nurses right now in attendance as well as others who are observing the nurses of the PNP. Ma'am, do you have any message?
Actually, nasabi ko na rin kanina. So sabi ko lang, thank you talaga for your attendance, sabi ko. And maganda talaga itong toxicology nursing kasi marami pa ang hindi aware dito. And then maraming kahit isa wala pa po tayong nagkaroon ng mga nag-training na ganitong klaseng training. So kaya nga ini-encourage natin ng mga nurses, lalo yung mga bago ngayon, na mag-undergo ng ganitong klaseng training. Kasi first of a kind po na magkakaroon tayo nito. Meron pong nag-signify na isang lieutenant, hindi ko natandaan yung name. So sabi ko, magandang start ito. So sabi ko kay, actually, itong partnership na ito na sinasabi ni Sir Son is, ginawa na rin natin ito at sinabi na natin ito sa PGH, yung sa pangunguna ng mga personnel sa DINET, lalo si Ma'am Oliver. So, alam na nila na itong ginagawa natin ay para lumawak pa ang mga kaalaman ng ating nurses pagka nagkaroon sila ng mga specialty training, nag-avail ng mga ganitong klaseng training. We have marami pong pool of mga educators, mga instructors po sa PGH, kaya po hindi po mahihirapan ng ating mga kapulisan, lalo mga nurses na mag-avail nito. Meron lang po akong isang good news na pwedeng sabihin ngayon dahil hindi lang po pala PGH ang pwedeng mag-offer ng mga training na ganito. We are also encouraging our personnel to avail the free training po sa ibang sa hospital, private, both private po and government, lalo na po sa De Los Santos and Makati Medical Center. So if ever, so narinig niyo naman kung merong interested talaga, we will send you for training, but sad to say that only 10% po ang kailangan na mapadala natin out of the total strength. So we have a list of those who signified, but only hindi lahat po sila ma-accommodate. So maybe this is part na lang po ng planning namin na after this batch, meron na namang next and next and next. So until na maubos po lahat ang mga nurses natin na magkaroon ng maraming iba't ibang specialty training, clinical skills po. So with that po, I just would like to thank you for participating today. Maganda po itong maganda pong simula ito na tayo ay So yun lang po Ace. Maraming salamat sa kanila, sa ating lahat. At ito ay naging successful po sa araw na ito. Kahit po only a few hours lang po ito, pero marami po tayong natutunan kay Sir Son. And yun po, sana marami pa po tayong magawang ganitong klaseng programa para po sa ating mga kapulisan, mga nurses po. Thank you very much.
Thank you, ma'am. Maraming salamat po. So that ends our short session po. Ay alam ko po nag-overtime tayo ng 42 minutes. So I'm very sorry po sa ating inimbitan po and same time sa mga participants. But nonetheless, mukhang marami na po tayong natutunan. So with that po, sir, ma'am, to our chief nurse, si Ma'am Espina po, nakasama niya po dyan sa nursing division. Dito po sa ating PSMU or Police Strategy Management Unit, si Police Major Berto Dasso is also a nurse. And of course po, in behalf of our Director, Police Brigadier General Jezebel Medina, I am Police Major Magila Salvacion, the Public Information Officer of the PNP Health Service. Maraming salamat po at mabuhay po kayo at Happy International Nurses Day. So maraming salamat po. Abangan po ninyo yung ating post ng mga videos po na pinadala po ninyo ng mga different regions at saka ating chief nurse. So mamaya po ipopost na natin yan. Subscribe lang po kayo. Siningit pa talaga, subscribe kayo sa Police Management na YouTube channel para makita po ninyo. But just the same, maraming salamat po and magandang araw sa lahat ng tao.